Hi, this is Dr. Ty Vincent again. I want to talk about what other things we might be able to do to help you if LDI doesn't work, because sometimes LDI doesn't work. I would say in the years of treating people with allergies, like when people have really clear allergies to a specific thing and you're really sure what the antigen is, LDI works maybe 90% of the time, 85, 90% of the time, like the vast majority of the time, but it doesn't work for some people. And it's always kind of unclear why. Like I can't figure out for one case or another, like why didn't it work for this person? Why didn't it work for that person? One of the things that I see commonly causing a lack of response, I guess, like the person just can't get well, and this is probably true for a lot of you out there, is a history of trauma. So like psychological trauma from abuse or stress or whatever in the past, all kinds of situations can lead to this, but people will have this just inherent sort of stress response, danger response, whatever, that just keeps going on, and it's originating in the limbic system of the brain probably, and sending this constant stress signal to the immune system that there's a fight to be done, right? A fight to be had, and you gotta go against it. And that sometimes is why people just cannot get well in general, and they won't respond to LDI. And so we've had some cases where we've decided that that's the avenue we should take. My opinion is currently, 2024, the best way to unravel those prior traumas and the best way to treat people is actually with psychedelic-assisted therapy. So we do that here in Kona. My wife Jeanette and I, we work with people with different medication substances that will help you get through that trauma, break down those walls, reintegrate that experience into your current existence, and it lets go of the hooks that prior experience has in you. People will actually be able to respond to LDI after that, or in some cases, they don't need LDI at all. We've had patients where one therapy session and their immune problems just stop without LDI. And so that's something I mention to people periodically, the use of these things that can help you rewire trauma responses in the brain and in the subconscious. That's one of the things that sometimes you need to do to get better. Another common thing is hormone imbalances or hormone deficiencies. A lot of hormones influence your immune system in one way or the other, and so various hormonal abnormalities can lead to chronic inflammatory and immune problems for people. And sometimes when the hormonal situation is the real big underlying factor, they just don't respond to LDI. So I work with people with that too. I can order laboratory tests from where we are in Hawaii, no matter where you are in the country. We can prescribe certain medications in other states as long as they're not controlled substances, or we can help you figure out where to obtain the things you might need to get your hormones back on track. Hormone replacement therapy is one of my big areas of expertise. I used to teach workshops to doctors for years about how to do bioidentical hormone therapy, and it's something I'm very skilled at. So that's another thing we can help people with directly from where we are. I've learned a lot about peptides in recent years, and so we can also guide people in the use and successful use of peptides for different things. Weight loss being a big one. We do a lot of fitness and weight loss oriented stuff with hormones and peptides for people, and we can actually do that for you from a distance as well. So besides just the immunological thing, there are other things we can potentially offer people to help them get through their chronic illness issues, and with other modalities and other therapies and things like that. So just keep that in mind. If LDI doesn't work, there might be something else we can delve into. I still will focus on immunological factors and how we're going to apply LDI when I meet you for your first consultation. I probably won't spend a lot of time getting into all that other stuff because I have an hour, and I have an hour to figure out how to approach you with LDI. But if there are clues to the other things, I may mention them at the time. I may suggest certain tests or certain things we do as well, because I have a holistic approach to what's wrong with people, and I try not to just focus on the one thing. I try to have a broader approach. So just keep that in mind. If LDI doesn't work, there might be other things that we can explore together that might get you where you need to be.